I didn't have insurance, and so I was looking for a place that I knew that I could feel that was a Christian base and also that cared about people.
Being on the fixed income, which is Social Security. I'm on a budget, okay, and couldn't possibly afford any dentist whatsoever.
Did all my feelings, it was for a good price, it was in my price range. And I just been coming ever since. They set me up on the dental plan. I followed it and I'm still following it. And now I have a bright, pretty smile.
I don't have insurance, medical insurance, and my job is so slow. You know, I just work like twice a week, and I really need it.
In the midst of our struggles, when life is most challenging, there is the Good Samaritan Health Center with a never-ending supply of compassion.
Hey, Malak, how are you? Fine, thank you. It's so good to see you.
Okay, I'm sorry. I know it hurts. Let's bring it down.
Our patients are people many times who lack financial well-being. They have health and care needs, emotional needs, you name it. And we are moved by compassion to care for them. When you see something, you have to react to it and do something about it in your own heart and mind. It's easier, though, not to see it and just avoid it altogether. So I think sometimes that's what people want to do. They just don't want to have to be faced with the reality of what poverty is all about and what we, as a wealthy society, can do about it. It's easy to just ignore it. Easy, isn't it? Yeah, it's easy, isn't it?
The Good Samaritan Health Center is the answer to God's call on Dr. Bill Warren, who had been in private pediatric practice for 13 years. The call became a mission to spread Christ's love through quality health care to those in need. In 1999, Good Samaritan opened its doors and went to work.
Hello.
Hello, Dr. Clay.
How are you doing today?
All right.
It will be about time that we schedule you for an ultrasound to see how the baby is doing inside you.
You'll feel pressure, but I don't want you to feel anything sharp.
Good Samaritan is a lifeline and, in fact, often the last and only hope for those seeking quality medical care, dental care, mental health counseling, health education, pharmaceutical services. The cost of service is based on a patient's ability to pay. Many simply can't afford to pay anything. The rest pay a very modest fee. On average, visits cost $110 and patients pay about $25. The balance is met through the generosity of donors, but the numbers only tell part of the story.
Most of the patients we see are you or me, except they've been caught in an economic situation where they can't afford health insurance, their job doesn't provide health insurance, and they can't quite get far enough up the economic ladder to be able to pay for private insurance. Yet, if they don't take care of their health until that time, they're going to have so many more problems and ultimately cost society more. So I feel that we're able to help people as they bridge the gap. Okay, what do we need to check up today?
You give them some hard and fast rules, but with love and compassion, and they give you a hug and tell you that they have never been treated in such a way as they've been treated like this. Sounds great.
Sounds great. Thank you. I love you.
We want to share God's love with them, and that is the greatest reward when they walk away and have sensed the love of Christ.
There was an elderly gentleman that came in. He had one tooth that he wanted pulled, but he had 3 or 4 others that obviously needed extracting. So I said, well, let's just go ahead and take them all out. And he was like, okay. So we took them all out. And at the end, I stopped, prayed with him, and he then had all this gauze in his mouth. He couldn't talk, so he asked the assistant for a piece of paper and a pen, and he wrote me a note, and he said, thank you so much for praying with me. That's the first time in 70 years that any doctor's ever done that. And he just, tears me up just to think about it, and he just gave me a big hug, and that's just what makes it all special.
She is missing some teeth when she first came to see us, and that was what she wanted addressed. So after several appointments and lots of impressions, we were able to get her these front teeth, and I'm going to show her now. This is our try-in stage, and we'll check together the result and take it from there. All right, so There's your teeth. And how do you feel about it, Miss Taylor?
Wonderful.
You're good?
For thousands of patients like Ms. Taylor, the Good Samaritan Health Center has been a lifesaver. But it cannot continue to be a force for good for individuals and the community as a whole without outside help. An army of volunteers and generous donors whom they count on for 75% of their operating expenses.
We could not do this alone. You have to have a team of people around you to make it work. And that team is very expansive. And it's like an octopus with its tentacles reaching out in many directions. I, as a physician, can't do everything. I need social workers. I need people who can teach folks on nutrition and diabetes. I need people who can do filing, people who can do record copying, people who can collect money. You have to have business people. You have to have nurses, physicians, dentists, clerical type people. You need people who can help with fundraising. You have people who can spread the word, as in marketers and public relations type people. You need a lot of people to make this kind of thing work. It is not about Bill Warren, it's about what God's doing here and about all these people he's brought to accomplish his work here.
For me, I get much more out of being here than I ever feel like I put into it.
Just them coming and embracing me. It's nothing like going around people when you're depressed that know you and know what's going on. They know how you're feeling down and you don't have to explain. It was like family.
The counselor here, she not only helped me to find a support group, she also encouraged me to come and to discuss whatever I'm going through. She was open enough. She has, as a matter of fact, she's still to this day have a hope and no policy for me.
The people like here are just fantastic, okay? They're friendly, they make you feel at home. It's just a warm feeling to come here.
Being a part of the volunteer force for Good Samaritan can take many forms. You can donate your time by helping at our main center in downtown Atlanta. You can donate much-needed funds through a one-time gift or an ongoing commitment. You can donate items for use by our patients, anything from Bibles to medical supplies. To whom much has been given, much is expected. At Good Samaritan, the spirit of compassion is alive and well, but the job is never finished. The need is never ending. The opportunity to make a difference is behind every door, on every examining table, in every dental chair, with every phone call, and every face-to-face encounter.
We're people who have hope because God has caused us to have hope. And we feel like we're transferring that hope to our patients. Because we are a place of hope and healing. And we give people an opportunity to be better, to live better. And we pray that not only are we sort of fixing their bodies, but their souls are also being regenerated, sensing that God is here and that God cares for them and loves them.
Hope for individuals and stability for our community. Who needs Good Samaritan? We all do.